As an abortion provider in New York, I can perform safe abortions when I, as a medical provider, deem them necessary.
In Texas, that's not an option. If I actually provided an abortion as I'm medically trained to do, I would face fines, lose my medical license, and spend life in jail.
Patients shouldn't have to travel thousands of miles to receive life-saving abortion care. They deserve to receive care in their communities by their community.
It's never been easy to provide abortion care here, even before the bans. And now, having to face patients who need your help, knowing you could safely provide it, but being legally prohibited from doing so feels downright inhumane.
Instead, most of my days are now spent helping connect patients to care out of state, helping people before or after their abortion, including folks who have self-managed their care, and referring others to prenatal care because the state has forced them to stay pregnant.
After Louisiana's abortion ban went into effect, I had the privilege of caring for a patient who traveled over 1,300 miles to come see us in New York City. Her pregnancy was highly desired, but had severe life-threatening complications.
As someone who has to refer my patients out of state for basic health care, it is infuriating and painful to witness. There are people who tell me they can't leave their kids to get care hundreds or thousands of miles from home, people who know they'll face more abuse if their partner finds out they're pregnant, and people who worry they'll die if they're forced to carry another pregnancy to term. All people I could have helped right here if we were allowed. Now this room sits empty while patients are needlessly suffering.
We see over and over that reproductive health care continues to be attacked from every corner. It's not just about abortion anymore. Now we see attacks on gender-affirming care, in vitro fertilization, and we are concerned that eventually these attacks will be directed toward birth control access.
Texas is that worst case scenario, but that doesn't mean fewer Texans are having abortions. They're just forced to find care elsewhere. So the state has just displaced and traumatized the people it should be protecting.
Despite New York being an access state, there are still so many barriers that patients face every day when trying to access abortion care. Transportation, to finances, immigration status, health insurance status.
As providers, we went to school for years to learn how to provide this kind of life-saving care. But with these bans, no matter how badly we want to help, we can't. What happens in Texas doesn't stay in Texas. We've seen that with abortion bans long before Roe v. Wade was overturned. So don't think that this reality couldn't soon come to you, because ultimately, this isn't actually about abortion. It's about power and control. No matter where you live, we need you in this fight with us, because our expertise and medical degrees don't shift the policies. Only people can do that.